Hello everyone, I am Dr. Monika Kumari, an IVF consultant. Today I am going to talk about endometriosis. First we should know about what is endometriosis. Endometrium means lining of the uterus. Endometriosis is the condition where the lining of the uterine tissue is found outside the uterus in the pelvis. This patient usually present with the very heavy menstrual bleeding. It also suffers from infertility, might have painful sexual intercourse and so on. So how to treat and deal these patients? First of all, diagnosis is very important. Any patient suffering from very painful bleeding, be it in the teenagers group or in any reproductive age groups, or in fact approaching menopause, you should always try to rule out this endometriosis. Why? First, it is a progressive disease. The more you have, the more the length of your menstrual cycle, the more the trouble will come. There is no permanent cure. The cure is ultimately the menopause, because it is a hormonal driven condition. So once you are devoid of the female hormone estrogen and the progesterone, these things will subside on its own. That is why the treatment of the condition depends upon what you want. First of all, to diagnose. How to diagnose and how to get rid of it. In the initial, like long back, people are their only option is that surgical diagnosis. Doing a laparoscopy, usually we said, is the gold standard, but nowadays things has changed many folds. Now the ultrasound is the first line investigation for this endometriosis. The things are coming up. The ultrasound is where we can see a different criteria and we tell about the extent of this endometriosis. So patient which is coming for endometriosis, we should know what is the age, what is the requirement, whether the patient wants any conception or not, what is the age of the patient, whether the patient is approaching menopause or not. Because once the patient which is very young age, they might have the planning to conceive in the future life, we should always try to conserve the fertility. So if you do ultrasound, try to assess the extent of spread, whether it has affected the uterus or not, that is called adenomyosis. If it affects the ovaries, that is called chocolate cyst. If it affects the surrounding area, you might have blocked tubes, you might have hydrosalpinx, and these things will compromise the fertility potential also. Patient which is coming for seeking a child, we should always try to assess the fertility, other things like whether the condition of tubes are okay or not, is the ovarian reserve good or not. If it is a small chocolate cyst, other things are fine. Patient can give a time for some time, like 6 months to 1 year. If it is a rapidly progressive endometriosis, the chocolate cyst is very big, ovary, the reserve is not seen, patient certainly go for an IVF expert to know about the chances of conception with different treatment modalities. And if the patient is really approaching the menopause, try to assess the extent of disease. Patient might have some conservative treatment with Mirena, hysteroscopic Mirena insertion, or the tablet Gynaecologist. These are the different kind of a hormonal medication where we try to postpone the plan till the patient approaches the menopause, because once the menopause approach, these symptoms will subside soon. So I would always suggest the patient to check for your condition endometriosis. If you are really suffering from endometriosis, go and meet your IVF consultant or IVF expert if you are really seeking a child before it becomes too late. Thank you.